We are privileged to welcome Dr. Geetha for the seat. And as the moderator for the session, we have Dr. Bishwajit Misra. Dr. Bishwajit Misra is Associate Professor of Pediatrics at HMCH Bhubaneswar. We kindly welcome you, sir.
Good afternoon, everyone. First of all, let me congratulate Dr. Manoj and team for an awesome academic feast that they have provided. And I am sure Dr. Geetha will be presenting many things which we know that our bodies, there have to be numerous and diverse population of microbiota. These are not visible to our naked eye, but their coexistence provides an essential foundation for our health and well-being. So how all this is being happening will be deliberated by ma'am. And I'm sure the world of microbiota is changing every day and probiotics are coming in a big way in the future. Thank you, madam.
Thank you, sir. Very good afternoon, ladies and gentlemen. At the outset, I'd like to thank Team IAP Neocon for inviting me for this session. A few disclaimers. I'm not a neonatologist. I'm a pediatric gastroenterologist. My job today is probably to just introduce you to the world, the amazing world of microbiota, which may have implications not only for your patients, but also for yourselves. So have you seen this picture? I'm sure you have seen this picture at many travel magazines or maybe on your own. It's a picture representative of the Great Barrier Reef. It's a picture of the coral reef, something which has multiples or millions of flora and fauna, all interdependent on each other, all living off each other and sustain each other. This is a picture of the great tropical forests of Amazon. Again, another ecosystem which has huge implications on the health of the world. Here also there are millions of flora and fauna, rich in minerals, fossil fuels, food to sustain themselves as well as the population of the planet. The importance of these two are the diversity and how each species depends on each other and sustains the other. What if I told you that there's an equally complex and wonderful ecosystem right within your human body? And this is the wonderful world of microbiota. Until 20 years ago, we were neglecting this particular organ or this particular ecosystem. We never even believed that it had any implication on our human health. We used to think of it as a cause of disease, a cause of germs, and cause of all our ills. But now we know this is not true, and the world is now exploding in the research of microbiota. And it's our duty and responsibility to look into this and how we can improve the health of both our patients and ourselves. So the microbiota consists of almost 100 trillion organisms and more, mostly of which are bacteria. They exist within our own gut and is our own coral reef or our own Amazon forest within ourselves. There are about 4,000 diverse species that have been identified. Altogether, they form about 1.5 kg, the weight of an adult liver, which is the largest organ besides the skin. So you have as much as 1.5 kg of microbes within you. And it has been seen that for every human cell, there are about 9 bacterial cells. This is slightly disputed, the number 9, but there are almost 9 bacterial cells that form a human. So are you more bacteria than are you human? Because it means you're only 10% human as it is. In the year 2000, the Human Genomic Project took shape, and it was thought that until then, all the developments of humankind, all the developments of science could bring us only up to this level of treating patients, treating diseases, bringing our successes. We were finding more and more failures or limitations to our treatment of patients. So it was thought that identifying the genes, the human genome, would help us find the root cause of all diseases. Thereby, we can find specific cures for specific diseases, and therefore we would be on our way to immortality. But this did not happen. At the time that this genomic project was going on, there was a bet among all the scientists who were involved in this project about how many genes could a human being actually be having. It was by then known that mice had about 23,000 genes, a wheat grain has 26,000 genes, a worm had around 20,000, 500 genes. So what do you think would be a human being's genes? And the common talk among the scientists was that it could be 40, it could be 50, it could be 100. The highest was 150,000 genes. That was the bet. Ultimately, it was won by a person who expected that the genes would be 40,000, but in actuality, the number of human genes is just short of 21,000. So we are no bigger than a worm when you take in terms of genes. How can a human being so intelligent, so full of complicated stuff, be just little more than a worm in genes? Is that all we're made of, or can we really find the answers to all our problems in genes? Actually, the 100 trillion microbes which are inside our body collectively form about 4.4 million genes, which is much more than our own genome. So is this just a coincidence, or is this just some trivia to be known and forgotten, or does it have any implications on our human health? This human genome project was subsequently followed up by a human microbiome project, which was initiated, and the first phase came out in 2012. The idea was to find more information on what makes us who we are. It's not just the amount of genes that we have, but it's also the genes of the organisms that we contain. And these organisms are there from the time we are born till the time we die. So it is only common sense to understand that these genes would be having an implication on our human health. So the interaction of the microbiome and the human genes was then found to be important in all our activities, all our diseases. So we know that certain jobs are done by the human genes, certain jobs are outsourced to this bacteria, and certain jobs are done by the interaction of these two. So understanding the implications of these genes, of the microbiome, and the interactions would probably hold the key for our future health. So the key to good health or better health is literally within yourselves, and we should not be ignoring this. As we know, and you're all neonatologists here, we develop from 3 tubes. The one tube which develops in the neurosystem is given as important as the brain of the body. The second tube, the heart, is also a vital organ. Somehow the third tube, which develops into the GI system, is not considered to be a vital organ. It's considered to be a secondary organ, but that may hold the key to the better development or the better longevity of the human race. So the microbiome is just an overview that I'm giving here. It's not a detailed discussion, just to interest you in the subject. It starts in the oral cavity, it's present on our skin and extends up to the anal cavity. And as you go down, you'll find that the number of bacteria or organisms keeps on increasing exponentially, and it's maximum in the colon. So the term microbiota is basically used to refer to the organisms, and the microbiome is to their genes. Now, one of the initial diseases which was studied in relation to microbiota was inflammatory bowel disease. Now, inflammatory bowel disease is common in most developed countries and is also increasing in Kerala, in the developing countries also. It was thought to be a genetic cause in association with the environmental triggers, which would result in a disruption of the mucosal barrier. And it was found that no matter how much medication you give, no matter how much advances you came in the treatment of inflammatory bowel disease, in spite of biologicals, you still could not reach that point where you could cure all these patients, or you could even bring about remission in all these patients. It was then found that probably we're looking in the wrong direction. To allow for better efficacy of these medications, it was probably time to look into the microbiome. And it has also been identified that dysbiosis, or a disruption in the microbiome of the human body, could be the reason why we are perpetuating or the disease does not come under control. And this has been evidenced by the remission induced by giving elemental diet and fecal microbiota transplantation. By doing this, we have found that patients who had not responded to biologicals, not responded to advanced medications, started getting responses to the treatment. So simultaneous research, not only in newer biologicals or neuromolecules, but also in the biome, would help us not only in establishing cure, but also in preventing the diseases. Because as you know, these diseases have a genetic component and an environmental hit. If you can obviate the environmental hit, you could probably prevent this disease from happening in genetically susceptible individuals. Now, functional GI diseases is probably something which affects all of us as adults. Not much is known about the etiology, but there's been a definite link with microbiota. There has been improvement in symptoms on manipulating the microbiome. And in future, there's a lot of research going on presently and in the last 5 years about what functional bowel disease entails. And probably classification in the future would be looking at a particular individual, looking at his microbiome, and based on that microbiome, the treatment can also be tuned in such a way that they get the best outcome. Liver diseases. Now, cirrhosis is a common condition seen above age 50 in most populations. But what causes some patients to go rapidly into decomposition or rapidly into worsening of the disease, even though all other factors remain common, is still not known. Now, possibility of this being related to the microbiome of the individual is gathering a lot of importance. The incidence of hepatic encephalopathy, it has been known in studies that it can be reduced by giving fecal microbiota transplantation. Alcoholic hepatitis has known to be improved. The enzymes have come down and the recovery of these patients has been quite rapid while giving FMT. Acute and chronic hepatitis, the progression has been reduced, and even NAFLD, which is now an emerging disease in adult population, this has also been found to be improved by doing FMTs and probiotic manipulation. Now, aging and the microbiome has been an oft-studied subject. As you can see in this diagram, the newborn, which is thought to be born sterile at the time of birth, and I'm sure this has great implications for neonatologists. If the child undergoes a normal birth as opposed to a cesarean birth, the type of microbiota that he gets is different. As the child grows older, the weaning period and then the subsequent diet results in the different kinds of microbiota. If you see the pictures in blue and pink, these are the common microbiota which are necessary for better health. These are Firmicutes and Bacteroides, which are present in healthy people, but children by the time they're 6 or 7 years of age. So by 6 or 7 years of age, your microbiome is effectively established. And no matter what you undergo after that, even if you take antibiotics or you have a disease, if your microbiota or the healthy microbiota is established by that time, it cannot be disrupted by a few antibiotics. But this particular phase is crucial. If in the first year of life, you are exposed to multiple antibiotics or a hostile environment, this can affect your microbiota to a detrimental effect. And supposing you get the bad microbiota, even that cannot be dislodged beyond your 6 years of life. So what happens to you when you're an adult or in old age is reflective of what you ate or what infections you had, what antibiotics you had, or what microbiome you got when you were 5 or 6 years of age. So hence the importance of pediatricians and neonatologists in this particular topic, that you will probably be responsible for establishing good microbiota for your patients. So age-related diseases, now we know that inflammaging, that is a chronic low-grade inflammation, is the reason, in addition to immunosenescence, that is aging of the cells plus this chronic inflammation, results in some people developing Alzheimer's, diabetes, atherosclerosis, and all the aging diseases. So some people live to be a very healthy 80 and 85 with no dementia. But some people get it at 60. It is not just genes, it is also probably a dysbiotic gut that is acting as a catalyst. Also in cancer, it has been proven by evidence that patients with gastric cancer, colorectal cancer, pancreatic cancer, etc., and liver cancer, this biosis can actively act as a catalyst in promoting tumorigenesis. It can increase resistance to the chemotherapy. So some people respond very well to the chemotherapy. Some people don't, probably because of the microbiome. And some bacteria actually help you to respond better to these medications. It is also known that secondary bile acids have a anti-tumorigenic activity, and secondary bile acids are reduced when your microbiome is affected. So Bacteroides and Firmicutes, because these are all tongue-twisting names, I would just put that there and say that these are the bacteria that you should be trying to encourage in your gut. So in future, when we have reached the limit of cancer chemotherapy and there is nothing more to go by, it would probably be a personalized approach based on what genes you have, what microbiome you have, and what disease you have. So a combination of this would be the reason or the way forward in all these medication, in all these conditions. Now, it is already known that there's a gut-brain axis. But do you know that there's also a gut-lung axis, a gut endocrine axis, and a gut immune axis? Recent research has now shown that the gut microbiome plays an important role in lung maturity, in brain development, in developing of puberty, as well as all the hormones, as well as in how you respond to diseases. Therefore, it is now, I'm not saying that it is the reason and the cure for all diseases, but there is increasing evidence that it could be the response, it could be a good reason why children develop ADHD, children develop autism spectrum disorders, because fecal microbiota transplantation in these patients have shown clinical improvement where medication has not. So neurodevelopment and dysbiosis could go a long way in determining your neurological development. It is already well known that allergic conditions are increasing in number. We see a lot of cow milk protein allergy, a lot of patients with allergy to multiple dietary substances. This is because of increased anti-inflammatory action because of the gut dysbiosis and also poor weaning practices. So if you want to prevent patients from developing allergic diseases, the microbiome may hold the key. Obesity. People becoming obese in older children as well as in adults have found to have a different set of microbiome, a different set of bacteria, which if you treat both by clearing up the bacteria as well as giving fermented foods or certain diets which improve the good bacteria, it is known to reduce obesity and the after effects of obesity, like insulin resistant, lipid profile interference. All this is found to be reversed, but it needs to be maintained for more than 4 to 5 years before this reaction is seen. So the key to obesity is probably not just running and jogging and dieting, but probably it lies in the type of diet you have and the type of microbiome that you're also harboring. Now, antibiotic resistant strains have been found in newborn babies who have not been exposed to antibiotics because their mothers were exposed to antibiotics in the antenatal. So this has implications for neonatologists and perinatologists. If you give antibiotics randomly or without any particular reason to the mother, it is possible that she harbors these antibiotic resistant strains in her or over her body, which then transfers onto the baby as the baby is born and results in antibiotic resistance in the baby even when the baby is not exposed to antibiotic. This can have later repercussions in the baby's life or in the adult's life and also for our society also. So what is the importance of this gut microbiome? I've given you an overview of the gut microbiome and what it entails in your future health, in the baby's future health. But the establishment of a gut microbiome, like I told you, occurs in the first 5 to 6 years of life. So even though it was thought that the intrauterine environment is sterile, it is found that it is not really so. There have been bacteria grown from the amniotic fluid as well as bacteria grown from the vernix caseosa, but all this is supposed to be the good bacteria. We have moved the pendulum from what was previously unhygienic delivery practices to an extremely hygienic or almost sterile environment, which is also not so good for the baby. The pendulum should swing back and probably come to a balance wherein we have hygienic practices, but not sterile environments or not completely sterile environment, because these are important for establishing the good bacteria, which is also important for the health of the baby. Now, vernix caseosa, which is present in the amniotic fluid, is now found to be a natural prebiotic which the child ingests, and therefore it has been found in the meconium of the baby and has repercussions on the microbiota that the baby develops later on. So vaginal delivery is, though is thought to be the first inoculation, the baby has already taken some bacteria when he was in the amniotic fluid. The next inoculation would be the vaginal delivery and subsequent breastfeeding. This gives diversity to the bacteria. It is not enough if you have a particular species inside you. It is important that you have a diverse group of bacteria which shapes or molds or allows the microbiome to mature. This in turn is important for maturing the immune system of the baby, which can protect the baby for the rest of his lifetime. The next best window or the next window of opportunity for these babies would be the weaning period. So a proper weaning period with proper diet. Nowadays, the diet for babies at 6 months of age is not the traditional diet, not the fermented food that we've been used to. It is all packaged foods and packaged materials. This definitely has an effect on the microbiome of the baby, which can shape the future health. If you could do one thing to improve the health of the baby, besides what you're already doing, it would be to ensure that the baby is breastfed, the baby is born vaginally, and the baby's weaning practices are healthy. So these are important things which we do not realize has an important role for the rest of the life, for the next 70 to 80 years of the baby's lifetime. So early life events, what you're already doing, I would not emphasize on that, because this has already been said. A cesarean section is inevitable in certain conditions, but after that you can always ensure that the baby takes breastfeeds and is not exposed to too much of antibiotics unless absolutely necessary. The sterile environment in the NICU, the exposure to doctors who may be carrying resistant bugs are all challenges for the preterm. For term babies, vaginal delivery, rooming, breastfeeding is the best thing that you can do for the baby. And for all babies, regardless whether they're preterm or term babies, when you introduce a weaning diet, make sure that the weaning diet is good and healthy and traditional. This is how you can introduce or establish a good microbiome. By 6 to 8 years of life, like I told you, the microbiome has become stable. It can be temporarily disturbed when you get an illness or antibiotic, but is always restored by itself. Not by taking probiotics, but by itself because of your diet and your initial microbiome. And it's difficult to change once established. You can do, if you want to change from a bad microbiome to good microbiome by taking probiotics, you may be able to change it for a short while. But the moment you stop taking probiotics, you go back to what you originally had. The only thing that can actually make a big change in that case is only a fecal microbiota transplantation. So the next generation probiotics, what is my opinion on the present day probiotics? They definitely have some temporary changes in the body, but are definitely not ideal. So we are looking forward to a next generation probiotic to identify commensal bacteria, which can be developed into more efficacious probiotics, which can eliminate even pathogens and play the role of what the microbiota is doing presently in our body, prevent antibiotic resistant bacteria, and also reduce the inflammation that I earlier mentioned, thereby preventing all these lifestyle diseases like functional bowel disease, hypertension, diabetes, etc. Therefore, the role should probably be more preventive rather than therapeutic. More work needs to be done. What we know is probably just the tip of the iceberg, but we are hopeful that in future, or our children can have the benefit of this microbiome. The knowledge at present is limited regarding which bacteria, how much should be given, how often it can be given, and what it actually causes. And since we know that the bacteria are good, but how do they actually affect the disease, or what are the interactions, is yet to be determined. So that is what we know, what we think we know, and an awful lot which we don't have a clue about, but we'll talk about it nevertheless, at least to keep the dialogue going. So the future is full of exciting possibilities. What we need to focus on is the functional core microbiome. Just like I told you, the microbiome, the gene, and the interaction is what is going to be the future. Beyond FMT, even though it is very efficacious, has an UG value. It is a quite icky thing as of now, but it probably will become more palatable in the future with better diagnostics and better therapeutics. But how to alter the microbiome would hold the key to probable future immortality of man. But it is a long way to go before it comes to clinical practice. So I thank you for listening to me. I can take some questions.
We can take 1 to 2 questions. Any question?
Yes, ma'am.
Yes, yes, sir. Yes, ma'am.
I want your recommendation on, how to have a healthy microbiome for the adult.
For the adult. Okay, so like I told you, ma'am, by 6 to 8 years of life, or by 10 years of life, your microbiome is fairly well established. If you want to change your microbiome beyond this, as an adult, you would have to take more of fermented foods, go healthy, stop taking much of, you can take meat once a week. This is the recommendation. You can take meat once a week or even less. And you should go down on your fatty food, have less of sugar. The carbohydrate in your diet should come down. You should take an adequate amount of proteins and good amount of fiber. Now, this is just the balanced diet which everybody's been talking about, but we hardly take a look into what we're actually eating. The second thing that I would like to recommend in this present day scenario is go completely off processed foods. Now, processed foods means everything. If you read labels of even things which are purported to be natural, you'll find that a lot of preservatives are added to increase the shelf life. So if you can, if about 100 years ago, if you could go back, you will find that there were no supermarkets, no processed food, nothing available in a packet. So if you really want to have a healthy microbiome in your body from now on, this should be practiced for years, and you can establish that. You can establish a better microbiome by going as close to the farm as possible, or as close to the cereal, non-processed cereals, non-processed grains, the fresh grain, as fresh as possible, fresh produce, non-preserved fruits. It's very difficult to do in real life, but as far as possible, go back to nature. Go back to nature and try and avoid taking anything that contains added fat, trans fat, or saturated, or you can take healthy saturated fat, but not the unhealthy saturated fat. Reduce the amount of sugar in your diet, increase the amount of fiber, and go slow on meat. This is the best way, especially when you cross 50, it is time for you to look after your colon. So these are the recommendations for having a healthy microbiome, but it's not enough if you take it for 3 months or 6 months or 1 year. You must take it for years and years, and you should change your lifestyle and make it a way of life. That way it can have beneficial effects, even if your microbiome was not healthy to begin with.
Great, thank you.
Thank you, ma'am.
Thank you. Thank you, Dr. Geetha. Yes.